Hi everyone, my name is Stanley, and I would like to share with you a topic on osteoarthritis. I want to begin by talking about the definition. As you can see, there's a definition. Um, Basically, those osteoarthritis is the degeneration of lining joints of the hyaline cartilage, and it's caused by age factors. I mean, there's a multiplicity of factors, but primarily caused by age. When you're aging, there's also a cause related to genetic disorders, or what we call joint trauma, and then any kind of infection, right, or infection. Now, for osteoarthritis, the signs and symptoms. Usually, signs are what the medical expert or health professional is observing, and then the symptoms is what the patient is actually experiencing in terms of what he says the problem is related to him. So, usually with osteoarthritis, the patient will say something like, experiencing painful pains in the two joint bones, anytime he moves. Anytime he moves, the two bones grind together. And then to when you hear something like that as a medical expert, you want to probably confirm that by making an observation in terms of a sign, whether the patient should uh, try to observe the patient walk, take a two-step, and see the patient's demeanor and countenance during any movement. Sometimes that can be done by that can be done the signs can also be observed by the medical expert. The medical expert observes the patient's pains in joints through physical examination. Like I said, you can also recommend for maybe X-rays and things like that, just to confirm whatever symptoms that the patient is actually experiencing. From the diagnostic investigation, maybe through X-rays and stuff, or through microscopic um, lab experiments, usually what will be you witness is that the proteoglycans get destroyed, and then the collagen fibers also get destroyed. You will be able to see that these are these actually have actually happened or occurred. Usually, with the osteoarthritis, the fact that the patient says this is what they're experiencing, you don't have to jump into conclusion. You have to carry out the diagnostic investigation to be able to confirm whether the proteoglycans have been destroyed or the collagen fibers have been destroyed. And now what happens is that the cartilage also becomes less resistant to mechanical stress at the joint. And then also the cartilage continues to degenerate, when the cartilage continues to degenerate until the underlying bone is exposed. Then we can say that osteoarthritis is actually apparent or apparent. Also, to manage it or to treat something like that, um, something called the glucosamine, or the dietary is a dietary supplement that has sugar or glucose from the shellfish, and then a microbe known as the fungi. And this fungi is actually used by the chondroblast. And that dietary supplement that has the sugar from the shellfish and the fungi use the chondroblast to produce more proteoglycan, which actually slows down the degeneration of the cartilage, which actually causes the osteoarthritis, and that helps. But currently, the prognosis or the outcome of these stuff, the treatment, is that there are mixed results. There are mixed results. So further studies need to be done. Basically, there's not enough evidence to support the null hypothesis that glucosamine supplement stalls osteoarthritis, or it actually stalls the degeneration of the cartilage, the degeneration of the cartilage. So that um, further experiment and studies need to be carried out in order to be able to get to support the null hypothesis. All right. I want to give credit to our textbook for Bio 20. I got that some of the information from page 144. as you can see from page 144 of our textbook, which is by Anatomy and Physiology by, I think, Ammerman, which is that's where I got that information. Now you can see that this is a normal, from the images, is a normal cartilage. Everything is, you don't see any degeneration here. Everything is it's normal and perfect. But over here, this is what happens when the cartilage gets degenerated, right? You see that these the fibers get torn, right? They get destroyed. That's what you can see here. They get, torn. But this thing, it takes time. It's a gradual process for it to actually get to this point. The underlying bone and the cartilages they continue to degenerate till they get to this point where they actually become worn out. As you can see here, there's a normal one. So here you can see that the cells are actually getting deteriorated and getting broken over here. All right, I hope this information helps, and I'll talk to you later. All right, take care. Bye.